So I work for the Nottinghamshire Healthcare Trust. That is a community and mental health services trust. And I guess like many trusts of its size has been formed by mergers and acquisitions. So long-standing history as a mental health trust, but in the recent past acquired community health services as well. About this time last year, we decided to run a procurement for a portal for our clinicians, and we did a quick look around the marketplace. I know that marketplace relatively well. Restart are relatively new joiners into that marketplace, and I hadn't any knowledge of them before we started that procurement particularly. I knew the guys who run the company from previous companies they'd worked with. And we ran the procurement and bought the product. So the clinical portal project with Restart is designed to break down some of the silos of data between our different types of clinicians. So we used two main systems. We use Rio for mental health and we use System 1 for physical health. And pretty much the users of one system don't access the other or wouldn't know how to if they did. And as a consequence, some of our data gets rekeyed. So some physical health data gets rekeyed into the mental health system and occasionally vice versa as well. But the real flaw is that no one's actually looking at patient data from a holistic perspective. So they're not actually looking at the individual, their family members and their circumstances. So that's why we went out to buy a portal, and that's what Viper is designed to do for us. A couple of reasons really. I mean, functionally wise it met the bill. I was attracted by the fact that it uses open source components so that the actual license hit year after year is much less than competitor products. And actually from a price point perspective, it was significantly less expensive than what I'd call the other big three substantive players in the market. And they're a British SME, and I think procurement law doesn't say you should support British small and medium enterprises, but given a choice, I think we should. So in the first phase of implementation it's really a trial in one quite small service in the child and adolescent mental health services, where again, because the service is split, some of it's in System 1 and some of it's in Rio, so we're going to get a set of users who have become familiar with looking at the data from the other systems, and then we'll evaluate that and decide which area of the trust is best suited to go next to. We're conscious that some of our pharmacy colleagues do have to rekey drugs data out of System 1 and into Rio. That seems like low-hanging fruit to go after next, but at the moment we just want to prove it works with one small service, get the user feedback, tweak it to meet their needs if we've missed any, and then use that as a platform to launch it around the rest of the organisation. Having established that we needed a clinical portal that would allow our clinicians to look in our different patient care systems, we ran a quick procurement using the catalogue services, so it didn't take very long, and significantly Restart has a couple of advantages over the other major players. First one is price. It's significantly less expensive, and I think the reason for that is linked to the second, which is it uses some open source components, thereby insulating us from the sort of per annum license support and maintenance fee which most software companies try to extract from you. So a big fan of open source from that perspective, and the benefits of it are passed directly on towards the customer through the price, which is affordable.